As you may or may not be aware, at the end of the day today, the public health emergency declared 3 years ago officially comes to an end. And I just wanted to review with folks the state of the pandemic, lest we just let this pass into our subconscious and not keep it in the front. Let's see. So these are the current COVID-19 monthly trends at a glance. This is the most recent data from May 4th. Total deaths in the United States, 1,131,000 and counting. Current hospitalizations in the United States related to COVID, 8,563. In the last 4 weeks, 4,700 Americans have died from COVID-19. And only 0.2% of eligible Americans have chosen to receive the most recent bivalent booster. This is just a graphic illustration of the fact that this is where we were in the past. Things feel and seem better and are better, but it's not zero. The COVID-19 is the 4th leading cause of death in the United States, behind heart disease, cancer, and unintentional injury. It's ahead of stroke, it's ahead of diabetes, it's ahead of kidney disease, etc. This is community transmission levels. This graph on the right of this slide is the one I'm pointing out. This gray spot is because Iowa has decided to stop reporting to the CDC, so we have no data on what's going on in Iowa. But if you notice, New York State, in the southern tier, transmission is high currently, and our own transmission locally is moderate. So we take care of a lot of people from the southern tier, and that's worth noting. This is vaccination rates. You'll see that there's been a little bit of an uptick recently as people have become a little more aware of what's going on, but vaccination rates are not particularly high. And this is VHA vaccination rates, something that we should continue to have conversations with our veterans about. Veterans over 65 and veterans with immunosuppressive conditions are eligible for the most recent bivalent booster, and we have that available on the 3rd floor vaccine clinic. So the public health emergency expires at the end of the day today. The Save Lives Act authority, which went along with that, expires, making it unlawful for VA to provide vaccines to uncovered individuals. As you may recall, under the special authorization, we were able to give vaccines to caregivers, spouses, and veterans not eligible for VA healthcare. That is no longer the case, and we can only give vaccines to employees and to veterans who are eligible for VA healthcare. And the EUAs, the emergency use authorizations for both vaccines and lab testing, are not expiring, but do change. And so if you have any questions about that, please get in touch with us. So that's the state of the pandemic. It's just because the public health emergency went away doesn't mean that the virus went away. Thanks for letting me take that extra bit of time this morning.
Dr. Howard, the next question is going to be a masking. Have we received any information at the national level about where we stand with masking?
We have not received any additional guidance beyond the current policies. I would not be at all surprised if there are changes upcoming, but we don't have them as yet.
Good morning, it's Chris from IP. Dr. Gelman, who's been leading, the charge, or one of the leading IP specialists, he has told us that the group is working on new guidance, whether that's masking or not, but it is guidance for testing and how we're going to handle the changes through CDC and community levels. So there, over the next couple of days to weeks, they said we will have additional guidance to share with you, and our team is all over that. So we should have it shortly.
Thank you.
Nicole, in answer to your question, what about patient masking? There are no changes in the policy.
Right, Dr. Halloran? Thank you, Dr. Howard.
There are no changes to the masking policy as of yet.
Thank you, Chris. Thank you, Dr. Halloran. Dr. Halloran, or Dr. Howard and Dr. Halloran.
Good morning. I have nothing.